take another call. I think there's another call on. Hi, you're on the air. Do you have a question?
Good evening to you
Good
both,
evening.
okay? This is Joe.
Yes?
Yeah, I'd like to know, I have this, lately this naturopath told me I have this problem with a tear duct blockage, and I thought it was an infection a long time ago, right? So I hear that I got this way because I have this yeast problem. So right now my stomach doesn't really rumble like it used to, and my eyes continue to burn and burn, so I'm trying this eye bright, and it's sort of working, and then I could drink it too, they say. Should I take acidophilus or continue with eye bright or what? And also there's something that gets in my eye. I think it's the tears from the bottom of the eyelashes. The tears get hard in the morning, and something gets in my eyes. Could this cause a problem with my eyes too?
Again, not to be specific, to generalize, what I have found, and I've talked about it in this journal article, is that people with candidiasis, for example, some people can't even wear their contact lenses because the eye is swollen a bit and can form little deposits. It's like eyelid dandruff in the lower eyelashes that can get into the eye. So
sounds irritating.
Oh yes. So it sounds plausible. Now, the business about tear ducts is interesting because if it's not both tear ducts and it's just one, it's possible that one of the tear ducts is a little narrower. And we see this a lot with babies. Sometimes they even have to have their tear duct dilated with a little probe. Now, I'm sure your doctors will advise you about that. But it seems to me for people to get it out of, a place like their eyes, they have to do a little more than just avoid sugar and avoid, well, the treatment that I go through with people, again to generalize and not to be specific for your case, but it's avoiding sugar, bread with yeast, and dairy products for 3 weeks, at which point the yeast then is starving in the intestines. And the reason for yogurt or acidophilus is to build up the good bacteria, again in the intestines. And we're hoping with that they'll starve off. Now they can be growing in mucous membranes, nose, mouth, and then I suppose, now I'm not saying to people that they're growing yeast in their eyes, but it could be the toxins from the yeast. So we're talking about lowering the level of the toxins or byproducts from the yeast so that they stay out of these areas like the eyes.
So then, to Joe, then it's a matter of going through and really going into a program and staying with it long enough to see if in fact it's going to help you.
But to be careful at the same time, because what I have observed in some people who, for example, take a lot of sugar and drink alcohol and take bread every day, if you strictly go off those things tomorrow, you could have a lot of side effects, a lot of withdrawal effects. So I'm not in any way recommending that. Whatever you do, do it after you've read some books, talk to your doctor or naturopath, and make a study of it.
Okay, Joe?
Or I could go off it just slowly, just like when you get off smoking, go off it slowly and
yes,
take the acidophilus?
Exactly.
Okay, thank you, Joe. Bye-bye. Well, that handles a lot of the situations that could crop up with that particular type of yeast. It seems to be rampant.
Again, women on birth control, the daily hormone intake can actually encourage yeast growth. It's a condition that is not recognized yet because it is fairly new. We've only been taking antibiotics on a daily basis and birth control pill for the past 30 years.
Well, I do want to get back to the book, and not only is it a book of remedies, but in it you can also ask or telephone in for a kit, a home kit, if you want to take a shot of that. And in this kit are what? What are these little
Well, what
containers?
happened when I wrote this book, I was talking a lot about homeopathic remedies, which tend to be very safe. I haven't seen side effects with them. This is not a kit that I personally am selling, but I've had a company make it up. And there are drugstores and health food stores that are distributing this kit. So it makes it easier for first aid at home. First signs of a cold, you take some aconite. If you have a fall, a sprain, or a bruise, you take some arnica. If you have a mucousy discharge, you take pulsatilla. And you read and study these things so that on a moment's notice you can do something about it.
That sounds terrific.
Just like, oh, I hurt myself, get some ice. Well, at the same time you think, oh yeah, let's get some arnica. And if we could all learn these things, I wish there were programs in school for children to learn.
Well,
about
you know, keep doing what you're doing, and there just well might be.
Right.
We have run out of time. It's been such a pleasure talking with you.
Thank you.
And thank you very much for being on the show.
Thank
Been
you.
speaking with Dr. Carolyn Dean, an MD. Now, if you want to contact somebody to get a hold of the book as well as the kit, this is the number you can call. It's 488-2600. And obviously, if you're out of town, then you'll have to dial 416. So stay with us, because when we return, Elaine will be speaking with Dr. Carolyn DeMarco. Stay with us.